Acute abdominal pain. You know that feeling? It's one of the most common reasons people find themselves in an emergency room. And frankly, it can be absolutely terrifying. But what if I told you that for almost 100 years, the standard way to treat this was to not give any pain relief? Today, we're diving into the incredible story of how medicine completely flipped its script on how to treat one of our most basic human experiences, pain.
So, to really get why this was such a huge deal, we have to travel back in time. We need to get inside the mind of a doctor from a century ago, standing over a patient who's just in absolute agony. They were trapped in a really difficult spot, one that was all about fear. Okay, picture this. It's 1921. There are no CT scans, no fancy imaging, no rapid lab tests. A doctor's best tools? Their hands and their own clinical judgment. The abdomen, for all intents and purposes, is a total black box, and they know something inside is going horribly wrong.
So there you are, with a patient literally writhing in pain. Your human instinct, your medical instinct, is to give them something to ease that suffering, right? But the medical wisdom of the day screamed, "Don't you dare." And the reason why? It all came down to this powerful idea that treating the pain was actually dangerous. And this wasn't just some casual advice, this was medical dogma. It's perfectly captured in this quote from one of the most famous surgical textbooks of the time. The fear, the big fear, was that giving a drug like morphine would mask the symptoms. Sure, it might stop the pain, but in doing so, it could hide the critical clues a surgeon needed to realize, oh no, this person has a ruptured appendix, until it was far, far too late. Now, to really appreciate why this fear had such a grip on medicine, we need to do a super quick dive into the biology of a stomach ache. Because the way our body signals pain from the abdomen is surprisingly complex, and it's that complexity that made diagnosing these things so incredibly hard back then. Basically, you've got two main pain signals coming from your abdomen. First up is visceral pain. This comes from your organs themselves, and it's really vague, a deep, crampy ache that's hard to pin down. But then you have somatic pain. This comes from the lining of your abdominal wall, and it is sharp, it's intense, and you can usually point with one finger to exactly where it hurts. Watching that pain evolve from vague and visceral to sharp and somatic was often the key clue that something really bad was happening. So what's causing all this chaos? Well, a lot of the time, the culprits are these little molecules called prostaglandins. When your body has an injury or inflammation, it releases these chemicals, and they are powerful. They make the smooth muscles in your gut contract like crazy. And that's why a serious stomach issue isn't just pain. It's also that awful cramping, nausea, and all the other miserable symptoms that come with it. So you can see the problem, right? You've got these vague early symptoms, and this huge fear of masking the one clear sign you might have, pain. It's pretty easy to see why that no pain meds rule stuck around for so long. So the question is, how did we ever break free from that dogma? In a word, science. That's what changed. Researchers started to actually question the old wisdom. They began to ask a really simple question. Does giving pain medication really lead to worse outcomes? Is this idea we've held onto for a century actually based on evidence, or is it just tradition? And the results were, well, they were absolutely revolutionary. Study after study came out looking at both adults and kids, and they all showed the same thing. Giving pain medicine was safe. It didn't mask the diagnosis. It didn't stop surgeons from figuring out what was wrong. In fact, it often helped. A patient who isn't screaming in agony can give a much clearer medical history. The evidence just became so overwhelming that, in the end, the very same textbook that started the myth had to retract its own warning. All right, so with that old dogma finally in the rearview mirror, the whole conversation shifted. It wasn't about if we should treat the pain anymore, but how we can do it best. And today, doctors have a whole toolkit of medications designed to attack pain from different angles. Let's break it down really quick. You've got your opioids, like morphine. These work on your nervous system to basically block the pain signals from ever reaching your brain. Then you have NSAIDs, like ibuprofen. Hey, remember those prostaglandins we just talked about? Well, NSAIDs work by stopping your body from making them, which tackles both the pain and the inflammation. And finally, for that horrible cramping, we have antispasmodics, which go right to the source and tell those spasming gut muscles to just relax. So, when you put this all together, what do you get? Well, it's more than just a new way of prescribing drugs. It's a fundamental shift in the whole philosophy of medicine, moving from just focusing on the disease to focusing on the actual patient. For decades and decades, the number one, all-consuming goal was to just figure out the pathology.
The patient's suffering, while, unfortunate, was seen as a secondary issue. It was almost treated like a necessary tool for diagnosis.
But what we understand now is that relieving a person's suffering isn't separate from the diagnostic process. It's a critical part of healing. Treating a patient's pain is a core responsibility. It's not just the compassionate thing to do, as all that evidence shows. It's the clinically sound thing to do, too.
This whole story is such a powerful reminder of how medicine learns and grows, and it kind of forces us to ask a really important question. What things that we believe are absolute medical truth today might future generations look back on with total disbelief? It's a great reminder that science is never settled. It's a process of always questioning.